This is the One Thing Podcast, and I'm your host, Dr. Adam Rindy. The One Thing Podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition. Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine. And now to today's episode. Chronic fatigue and chronic pain are some of the most debilitating health issues to have. For those suffering with these conditions, they'll be the first to tell you how they feel bounced around the medical system and often feel like they are left to their own devices to find solutions for their problems. In this episode, we speak about one potential solution, red light therapy, which is a type of photobiomodulation therapy. Essentially, it's using light in a specific wavelength to gain a therapeutic outcome. I'm delighted to have with me my treasured friend and colleague, Dr. Drew Sinatra, a naturopathic physician from Mill Valley, California, that specializes in chronic disease. He is someone I've known professionally for about 18 years, and he's really a rising star in our profession. He's a proponent of red light therapy clinically, and he will walk us through some background information about red light therapy, how it works, what it does to the body, how we might benefit from it, and he'll also guide us on how to get started if interested in trying red light therapy for your health conditions. So without further delay, I'm going to welcome on our guest, Dr. Drew Sinatra. All right, Dr. Sinatra, welcome to the One Thing Podcast. It's great to catch up after all these years.
Oh, it's so good to be here, Adam.
Yeah, it's nice to have followed you, your career, and I'm excited to bring this topic to our audience today. We're talking about photobiomodulation. Tell me a little bit about how you got into learning about photobiomodulation and sort of what brought you to your understanding of this topic.
Sure. Well, first, I just want your listeners to know how lucky you all are to have Adam as your host. He is one of the most amazing people I know, and I don't say that often. I mean, Adam, you truly are an amazing human being, and I want you and your listeners obviously to know that.
Well, that is really kind of you. Thank you.
We started off our career together as classmates, and then you were my supervisor at one point. We were friends. We're now colleagues, and so we've had the last 18 years together, actually learning.
Yes, exactly. Yeah, it's been quite a journey, and it's always great to see to get back together like this.
Absolutely. So to answer your question, how did I get into red light therapy? I had a patient. We'll call him Tim. And he has Ehlers-Danlos syndrome, EDS. And this is a connective tissue disorder where there's issues with ligaments and tendons and muscles and lots of instability issues. He actually had a dural leak at T12 at one point because he was having recurring headaches. And so he had an MRI and actually showed he had a dural leak, which was due to the EDS and the inability of the body to really keep things tight. And Tim came in and he'd seen all these doctors, Lyme specialists, mold specialists, you name it, every specialist under the sun he'd seen. I worked with him for about 2 years before he came to me with a book on red light therapy. And he said, Drew, you have to read this. So I read the book. And at the same time that he was reading the book, he was using these red light pads over his liver, over his abdomen, over his joints. And he definitely noticed an improvement with these red light pads. And then he looked up a machine called the Novothor, Novothor. And what this is a full body red light and near infrared light bed that you get into. And you're only in it for around 10 minutes or so. He did a couple sessions in that thing and he came in smiling and he said, Drew, feel my arm. And I felt his forearm, and instead of it feeling like beef jerky like it always does, it actually felt soft, like his muscles had finally relaxed. He actually has a very interesting EDS condition where it's more like he has muscle tightness especially in his neck and his pelvis. And what the red lights do, they actually just help relax his muscle tissue.
Hmm.
And
That makes sense. Yeah, because
yeah,
the hypermobility of that condition can, lead to tightness, right?
exactly. Yeah, and finally he'd received some benefit from something as simple as red light therapy, and that really opened my eyes to the therapy. And then I had a couple other different patient stories where a man who, it's interesting, he was having very loose stools and a little bit, lots of fat in the toilet bowl. Like he'd actually see a layer of oil in the toilet bowl. And he would use these red light pads over his abdomen. And when he did that, he noticed that he had a clean bowel movement in the morning. And when I heard that, I said,
Wow.
okay, that's very interesting. I'd never heard that before. And so you know how it is in medicine. You have your patients be your best teachers. And so I had all these patients come to me with their red light experiences, and I was so excited to learn more about them. And then I finally just completely dove in around the end of 2019, and since then I've just been on a full throttle journey with red lights.
So one of the things I've really appreciated about you over the years is the way you go into learning. And I remember one of my first years in private practice reaching out to you for some information on environmental medicine, and the depth of teaching that you provided for me from a simple question was truly appreciated and would have taken me hours of work. So I imagine when you saw these clinical benefits, you must have wanted to unpack like what's actually going on here.
Oh, thanks for that. Yes, when I first heard about the red lights and kept hearing story after story of benefits, it was um, I couldn't be stopped in terms of digging into the research more. So I read a couple of books, I've watched lots of videos on it, and lots of research as well, and then continued to see the benefits here of patients using it in the clinic.
That's great. So, why do you think it can, from a bigger picture, something like red light therapy came to the scene? Was it
Hmm.
sort of modernization of our human kind of life, or what? Like, why would we need red light therapies? Can't we just get red light from living?
That's a great question, Adam. And we get red light and near infrared light from the sun. That's kind of our primary source of it. And a lot of us are really sun deficient. We don't get outdoors enough. We lather on a lot of sunscreen, obviously, to help block the UV rays. And a lot of us actually spend most of our time indoors. In fact, there was a stat that came out a couple years ago. It said 87% of our time is spent indoors, plus another 6% of that time is spent in your car. So really, you add that up, there's 93% of your time on average spent indoors compared to outdoors. And our ancestors, they always had the exposure to the outdoors, whether it was in direct sun or indirect sun. And so if you look at it today, we're really light deficient. We're not getting these valuable wavelengths from the sun, the red light and the near infrared light particularly. And there's this whole thing called the electromagnetic spectrum. You probably remember that from biology classes. And what that is you've got gamma rays as very, 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 very tiny wavelengths. And at the end of that spectrum, you've got radio waves, which are very long wavelengths. And in between somewhere in that region is visible light. And that's where the Roy G. Biv comes up from the rainbow, right? So that's the red, orange, yellow, green, blue, indigo, violet. And so the red light falls at the end of that. So generally speaking, the range is around 630 to 670 in terms of the wavelength. And the near infrared light is right next to red light, but you can't see it, right? It's just off that visual spectrum. And those wavelengths run from like the 810 to 880 range. And so really a lot of the research has looked at these particular wavelengths. And for red light, it's around 650. And for near infrared light, it's around 850. And they've looked at those wavelengths and learned via all the research that's been done the potential mechanisms that they're causing in the body, which we'll get to in a moment, and also the health benefits that they're providing. So really, to answer your question, we're light deficient, and this method of red light and near infrared light therapy is a way to get out more, in a sense, to actually get that light exposure from the sun. But now you can do it in your home via a light panel or a red light therapy bed, or there's pads available, and there's all these different LED devices that you can use to get that exposure.
Hmm. Okay, so when you were researching this, what did you find out about the mechanisms? I've seen just lists of
Hmm.
hypotheses about how this is working, but like, did you drill down to a few things of understanding that you feel are solid?
I do. And I think what we know is that there are many different mechanisms for how the red and the near infrared lights work. Two of which I'll talk about today that we know are happening. One of which is this really cool concept, and Adam, I know you're familiar with this more than anyone, is the concept of hormesis or the hormetic effect.
Mm-hmm.
And this is when there's a mild metabolic stress that's put on the body, and that can be from fasting, caloric restriction, cold thermogenesis, even heat therapy like a sauna, for example. And exercise is actually one of the big examples of hormesis. And red light therapy actually falls into this category as well. And what happens is with red light therapy, there is a little bit of a stress on the body. There's actually a mild burst, brief mild burst of free radicals that occurs. And when that happens, your body detects those free radicals, and as a result, it tries to neutralize them. So it actually produces its own antioxidants like glutathione or catalase or superoxide dismutase. And when you're exposed to a mild stressor, which is the hormesis, via a red light, it's actually allowing your body to become more adaptable. It's becoming stronger in a sense because it's actually producing its own antioxidants and actually produces anti-inflammatory compounds as well, and can support detox too via the NERF pathway, the NRF2 pathway. So the hormesis mechanism is a really big one, and really one that I like because I'm all about fasting and I'm all about sauna therapy and
Mm-hmm.
cold hot exposure like you and I were taught in school with contrast hydrotherapy. So I'm really big into this hormetic effect. Now the other mechanism that I've dug a lot into and really researched is really cool. It's that your mitochondria have these photoreceptors on them. They're called the cytochrome C oxidase. It's actually it's an enzyme as well, but it's also considered a photoreceptor. And so when light, particularly the red light and the near infrared light, when that hits your skin, when your mitochondria are being hit by this light, the photoreceptors are activated. And what happens is the mitochondria now can actually utilize oxygen more efficiently. And when that happens, there's greater ATP production. And we know that when we have greater ATP production, there's more energy output and the body functions better as a whole. So that's a big mechanism right there, in the sense that you've got these really cool photoreceptors inside your mitochondria that are taking in the light, that are allowing the mitochondria to use oxygen more efficiently and produce more ATP.
That's just fascinating. Yeah, I'm really big into hormesis as well. I mean, it's fascinating. I first learned about them. You and I are both into plant medicine,
Mm.
and I first learned about hormesis through plants, right? Their defense and their ability to fight environmental pathogens and weather is largely a hormetic effect.
Mm.
And it's really interesting to see this happening in our own bodies as well.
Well, I don't know if you remember this, but you and I were in a botanical medicine class with Dr. Deb Brammer. Do you recall
Uh-huh.
that one?
Oh yeah.
And we were formulating a lot of different formulas using adaptogens. And it's so funny. The way I look at red light at this point is kind of how we viewed adaptogens when we first learned about them in school, because
Right.
you hear about them and you're like, oh my God, everyone needs adaptogens. Everyone needs to help
Right.
reduce and modulate stress in their body. And now when I hear something from a patient, whether they're in pain or they're having circulation issues or they want to work on anti-aging for their skin or they want their brain to function better, I think of red lights kind of in the same way that I used to think of
Yeah.
adaptogens.
Yeah. It's like a little nudge in one direction can get the body to do some self-healing mechanisms. It's just fascinating.
Exactly.
Yeah, that's funny. I do remember that class. I think it was like a master formulation class,
It
if I
was.
remember.
Yeah, it
Yeah.
was.
Yep. That was I really enjoyed that type of work. I still do.
Mm-hmm. Mm-hmm.
Um, so, well, when we're talking about this, taking the mechanisms and understanding what's happening in the body, what types of benefits would someone experience if, let's say their ATP production is going up and there's a hormetic effect and some of these repair, what types of benefits do you see coming from using this therapy?
Yeah, there's so many benefits because when you're increasing ATP production, you're allowing your cells to function much more efficiently. And, you know, red lights has been touted for a lot of anti-aging skin benefits. Like you may have heard of it for improving collagen synthesis, elastin production. And so it can really help prevent wrinkles. And your original question, Adam, was how did I learn about this, or at least when did we start learning about red lights? And actually, NASA was using red lights in the 80s and 90s and looking at how it actually improved plant growth.
Hmm.
And so, it has been around for a long time, at least 30, 40 years. And now it's just building because we're finding that these different effects that we're seeing in the body, like for example, I talked about the collagen, increasing that and helping with wrinkles. It's really helpful for reducing and modulating inflammation. So think of any condition where there's pain. There's been studies on reducing hair loss and actually helping improving hair growth. There's studies on tissue repair, and if someone has, let's say, an ulcer, like a diabetic ulcer that's not healing quickly, you want to put the red lights on there because it's actually going to help, obviously, with the ATP production and help repair a lot faster.
Mm-hmm.
And actually, my son, we were mountain biking the other day, and he took a nasty fall on the gravel near the parking lot, right when we did a great 2-hour ride, and he just all of a sudden happened to fall right at the end, and he skinned his elbow up. I mean, it was awful. I was like, goodness gracious, this is terrible. So immediately when we got home, I had him sit in front of the red light panel that we have, and I had him do around a 10-minute session, and that thing. This happened around 5 days ago, Adam, and I'll send you pictures. It has healed so quickly. It is unbelievable.
Wow. That's really nice. Yeah.
So, go ahead.
Yeah. So I've also heard some of the one of the ways I was first introduced to it, at least in the recent history, was hormone effect. Is there something to that as far as like testosterone and increasing testosterone levels in men?
Oh, yes. So, there's all these biohackers out there that say that the red lights, when they shine it on their testicles, can help boost testosterone. And it's so funny. I learned about these red lights actually years ago, or at least I heard about them at the A4M conference in Las Vegas. And I think that was one of the big claims back then. And I do believe that there has been some recent research on that. I don't think we're talking about like a huge gain in testosterone levels, but surely it does increase testosterone a little bit.
Mm-hmm. Yeah. So getting back to the people that, when you're talking through this, I would imagine people with fibromyalgia would just really do well with this.
Absolutely. And
It's
another
such a tough condition to treat.
it's so tough to treat.
And, obviously to live with, and, people, it's kind of an invisible pain to the people outside, looking at someone who has a fibromyalgia, and we're always trying to find ways to help people with fibro.
Yeah, and really, when you think about it, the red lights are really improving in circulation as well. They're building your vitality, and what I've seen using them in the clinic, because by the way, we have a Novathor here at Clear Center, and we have one of these massive red light therapy beds, and so we have patients come 2-3 times a week for the sessions. I've been doing 2 or 3 sessions a week here, and I also bought some panels. I have them at home, and I do them on a daily basis. And what I hear the most is that people, they do a couple sessions and they feel like their body is in less pain, and whether that's their muscles, the joints. And a lot of people sleep better when they have a session. So let's say they come in for a session at 9 in the morning. That night, they'll have a great sleep. And then you asked too about the hormone piece. At least for testosterone, yes, we know it might build testosterone levels. And apparently the red lights also have an effect on mood. And whether that's a hormonal piece or not, there certainly is an improvement in depression and anxiety. And I've noticed that people that have been doing this regularly, including myself, I feel very grounded. I feel very balanced in my body. Even with what's happening right now with coronavirus and even the riots, I feel like I'm in a very good place. And I wonder if it's because my vitality has been built so much over the last 3-4 months using these lights.
Mm-hmm. Yeah. So that'd be, interesting to hear more about like what you're using, at home, and also learn more about the clinical applications. So can you take us through the different, if you were to go out and purchase a red light therapy device, what would you look for? Because I picked up, when I first started getting into it, I picked up this 690 nanometer light. It was just kind of like a decorative light.
Hmm.
It's sort of like handheld, and I don't even know if I'm doing anything with it. So I mean, it seems to help. It seems to help, but I mean, it seems like there's so many different options these days. Where would you start? Kind of from the basic to people who may not have, a lot of money to put into it versus more kind of the high end one devices.
Right. Well, what you can't do, you can't just plug in a red light bulb and expect to receive benefits from it.
Right.
You do need to invest in one of these light panels. The good news is, though, is that the prices of these things have really come down over the years. And there's three companies that I primarily recommend. One is Platinum LED. One is Juve, which you're familiar with. And there's also Red Light Therapy Co. And really, there's a whole host of other companies now that are producing really high-powered red lights. But that's the key there is it has to be a high-power enough device. It has to have a high enough watts per centimeter squared power output to actually have an effect on the body. So, these panels can start off at anywhere from $369 for a small panel that you can use on local areas of your body. Like, let's say if you're having frozen shoulder or you're having knee pain, all you need is one of these smaller lights. And if you think about it, you invest $379 and you'll have that thing for 10 plus years. And so really all after that point you're just paying for electricity cost.
Right.
And you don't have to go out and buy these $120,000 Novathor beds like with what we have. They're certainly amazing devices, and I mean I can't speak highly enough of the Novathor. And there's all sorts of companies too that have different red light beds. But what you do need is something like a red light panel, like a Juve or a Platinum LED or the Red Light Therapy Co. That is either a small one around that $379 price range, or you can get a larger one, which is around close to $1,000 that does more full body. And when you're using these lights, you don't want to put your body directly against the red lights. You want to have a distance of at least 6 inches and perhaps even 12 inches. And we do that to reduce the EMF exposure because these devices are obviously putting off electromagnetic fields. And you don't need to use the devices that long. So if you have a red light panel that's hanging on the back of your door, you want to make sure that whatever area you're treating, whether it's your shoulder or your back, maybe it's your abdomen, that you remove the clothing on that area. So you really want to just kind of strip down and stand in front of it, 6 inches to 12 inches apart from the lights. And you really don't need that long of a time to be exposed to it. So really, it's somewhere around 10 minutes or maybe even 15 minutes. And you don't want to treat for too long, because I have heard reports here at the clinic where a patient that did the red light therapy bed, the Novathor bed, for too long. She did, I think, for 20 minutes. She was exhausted the rest of the day, and it's almost like it was a little bit too much for her system to handle.
Mm-hmm. Mm-hmm. Yeah, that makes sense. And so, from a clinical standpoint, do people come in and buy sort of or purchase sessions and then have a frequency that they come in weekly, or what's the general flow of people who are using it in your clinic?
Yeah, I'd say most people are coming in around 2 days a week, maybe 3 days a week. Like that patient of mine, the Ehlers-Danlos syndrome patient, Tim, he comes in 3 days a week. For him, that's a way to really maintain his health and really to help, plump up his collagen levels so that his tissues actually feel normal instead of feeling like beef jerky.
Yeah. Yeah. And I love this, because there's such a big need for pain management, and things other than NSAIDs and other than opioids. And this is so efficient, to go in for 10 minutes and have a session for 10 minutes and feel better.
Exactly. And what other supplement, what other medication out there has so many benefits as red light does when you think about all the mechanisms that it has and also the benefits in the body? I mean, it even has an effect on thyroid function. And there was a study done in 2010 where I think it was around, hold on, I have it written down here somewhere. It was around 38% of the participants that were being exposed to the red light, they were able to reduce their medication dose for thyroid.
That was Hashimoto's too, right?
And it was Hashimoto's, and apparently
Yeah.
some of the TPO antibodies have gone down with red light treatment as well.
Yeah, that I saw that. I was like, I need to find this study. That's really fascinating because, I mean, anybody who's dealing with Hashimoto's thyroiditis, which is autoimmune thyroid problem, knows that the antibodies getting them to nudge or go down is not something that's we typically can predict, right? It's difficult to do, and it may be a marker of improved thyroid function, and the fact that these people reduced the medication dose is obviously a marker of improved function. So if I can find that study, I'll put it in the show notes.
Mm-hmm. Yeah. So, I
So
mean, when we think of just something like that to have a powerful effect even on the thyroid, it's like, what other effect is it having on the body?
right, right, yeah. So this, other than making me want to get one of these devices, it also makes me just want to go lie on a beach somewhere.
Yeah. Well,
You live in California, so you have the ability to do that. I guess obviously more than I do up here in Seattle, but this is you're right. We're spending so much more time inside, and it's just really nice to have this option. So, what would be some of the take-home messages that you would say about photobiomodulation and just any kind of what you would want to leave people with?
yeah, I feel that if you're looking for a therapy that is relatively inexpensive, like we talked about these panels being, $379, for example, that will last you a long time. And you're someone that's in pain, you're someone that's that having hair loss, thyroid issues, you want to improve your exercise performance, muscle recovery, you're looking to improve your energy level, your sleep, all across the board. If you want to increase your vitality, I am such a huge believer at this point, after seeing all the results of my patients, including myself, that red light therapy is a simple thing to have on board to use on a daily basis, or at least 5 days a week if you have one of these machines at home, and you're gonna see some tremendous benefit over time. And another example, Adam, I wanted to share was that my mom had a hip replacement a couple months ago, and she was in a 9 out of 10 pain even on opioid medication, and she was suffering tremendously. It was painful for me to talk to her on the phone because I could hear that quiver in her voice telling me that she was in such pain. So I immediately bought her one of these smaller red light panels, sent it to her, and within a couple days, she said that her pain had gone down to around a 7 out of 10, and within a week, it was down to around a 6 out of 10. And she's walking all around the golf course at this point, and she also said that her scar is pretty much non-existent on her hip, where she had 2 knee replacements, and the scars on her knees are horrendous.
Wow.
So it's like you see these things over and over again, and with your family members and your patients, and also in my body as well, and it just makes you believe more in this therapy.
Right. Yeah, and I think it's important for people to realize that they're going to be drawn to different types of therapy. So this might be something that's missing for someone who is having chronic pain and they're not managing it with a pill. It's like, why not try it? I have a family member that I help quite often with chronic pain, and all the things that he goes through and he's tried. It's often because we just don't understand the mechanism of pain, and that the medications are firing at the wrong target. And so if someone finds that their chronic pain is suffering and the medications aren't working, it's often try something different that has a different therapeutic target. And this certainly has something that most medications will not do.
Yeah, and like what you said, what you said too is get out in the sun more, because that's ultimately what we're doing here. We're just getting light exposure, which is something that is so essential and and needed for our health. And so I recommend people, when they can, obviously during the summer months, get out in the sun as much as you can. Obviously, don't burn yourself, but even if it's an indirect light exposure, you're getting that valuable exposure to your skin and the rest of your body via the red and near infrared lights. And then couple that with, like you said, walking on a beach, for example. You're grounded, with no shoes on, walk barefoot. You've got the grounding aspect. You've got the seawater healing aspect as well. And you also have the light. So yes, walking on a beach is probably one of the healthiest things that you can do.
Yeah, yeah, definitely. Well, good. Well, tell us a little bit about your practice and what you're up to professionally so that we can continue to follow you. I mean, I just logged in quickly on your Facebook page and wow, you got quite a following on there. So congratulations.
Oh, thanks, Adam. Yeah, I think I treat a lot of conditions similar to what you're doing. Lots of complex chronic disease, a fair amount of Lyme disease or mold, mycotoxin illness, lots of autoimmune diseases, and obviously lots of hormonal support. So those are kind of the main things that I'm seeing. And I work at Clear Center of Health. It's an integrative medicine clinic here in Mill Valley. And I also work for Healthy Directions. That's a vitamin and mineral company where we do lots of things there in terms of research and writing articles. And we also launched a recent podcast. It's called Be Healthistic. And it's with my father, Dr. Steven Sinatra. I'm sure you remember him. I think you've heard him talk before.
Of course, yeah.
Yeah, he's such an amazing man, and I feel so honored to be able to co-host with him. And we talk about very similar stuff that you're talking to your audience about.
Great. Yeah. And I'll put a link up to that in our show notes. And, I think one of the things that's really great about what I've learned from listening to some of your podcasts and actually some of your webcasts is that you give really practical information, that everybody's facing, like things you can do better in your home and with your food and nutrition. It's just, I've really enjoyed and actually I've learned a lot from you by watching. I haven't yet gone on heard your podcast, but I've been watching some of the webcasts that you give.
Oh, thanks. Yeah. Well, Adam, I'd love to have you on our podcast at some point because you were really the pioneers, I believe, with SIBO when it first started coming out. And I remember listening to even a webinar of yours. I think it was back in 2012. And I'd love to get your take on new updates on that. So perhaps we can schedule that.
Thank you. I would appreciate that. Thank you so much. Well, is there any kind of resources that we can leave people with that I can share about photobiomodulation? I know that you've read some books, and is there anybody you want to mention just to kind of further people's learning?
Yeah, thanks for that, because I do want to give credit to Ari Whitten. He wrote an excellent book called The Ultimate Guide to Red Light Therapy. And this was the book that I mentioned at the beginning that my patient handed me. And I remember reading it. And after 20, 30 pages, I couldn't believe what I was reading. It was like, wow, there's some therapy out there that has this many benefits to it. And I really do thank Ari Whitten for putting his time in with doing all the research behind this and putting everything together. In terms of other resources, just looking up those red light panels I mentioned from Platinum LED or Juve or Red Light Therapy Co. They've got lots of interesting articles written about red light, how it works, what it does for benefits, and also how to use them properly.
Excellent. Well, thank you for your time, and all my best to your lovely family, and continue to do such great things.
Oh, thanks, Adam. I appreciate it.
Okay, we'll catch up down the road.
Sounds good.
Okay, thanks. Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.